Welcome to summer, and thank you once again for joining us on this community video. We hope the information that we're providing is valuable to you, and please share with your friends. It's my pleasure to have join me this week Margie Kochsmeier, who is our infection preventionist, who's been really an expert on the front lines helping to guide us through this ongoing challenge. And she's going to be sharing some insights with you on staying safe and still being able to enjoy your activities throughout the summer. So Margie, thanks for spending time with us to share.
We've learned so much over the past year. We've learned that the precautions that we've taken have helped us reduce the number of flu and RSV and the number of COVID patients that we saw. We have new health hygiene practices that we have followed. We've masked, we've learned how to do our hand hygiene, and that has all made a difference for us. That may not go away, and that is not a bad thing. We are in phase 5 of the COVID-19 pandemic, which means that businesses are open, but they may still have some requirements as far as masking and keeping some distance between you and other patrons. These safety guidances that we're following are going to help keep these businesses open so that they're there when we need them to be. We have access to testing and vaccine now that we didn't have a year ago. While the numbers are down right now, we are not out of danger of people getting critically ill from COVID-19. So please still take precautions. There are variant strains of COVID-19 that are out there right now that are going to be a risk for us. There's several variants out circulating right now, and the ones that I'm going to talk to you about are the ones that you have probably heard most often. The one was identified in the United Kingdom. This one transfers more easily between people than the original COVID-19 virus did. It's 50% more infectious than the original COVID, and it's got a higher amount of viral load, and this is what's making it more infectious for people. People who contract this may be at increased risk of illness and of death. The next one is the South Africa. And this one, there's nothing in current evidence that says that the symptoms are worse than the other strains. This is one that it escapes the antibodies that people who have had COVID disease have. So they are very susceptible to the South African. Vaccines may be less effective for this strain. The Brazil variant, now this one we're still learning about. It may be more transmissible than some of the other variants, and people again that have had COVID disease, while they have antibodies to the original COVID, they do not have antibodies to these variants. The Delta variant, this is the one you've probably heard the most about right now in the news, and this is the one that we have the most concern about. It's been out for about 6 months, and it is growing very quickly in the United States. This will probably be our most predominant strain this summer. The Delta variant, because it's highly infectious, this one is 90% more transmissible than the other variants. In 6 months, it has become the predominant strain for us. It's a great threat to us, and it's yet very contagious for people who have not been vaccinated. And again, people who have had COVID but are not vaccinated are very susceptible to this strain. The symptoms can be more severe with this one, and we are seeing more hospitalizations with it. All vaccines that have been approved in the United States do have some preventative effectiveness for all the variants. With a large number of people that have not gotten vaccinated, we can see a rapid spread of these variant strains that will cause another surge of infections for us. There is protection for all the variant strains to some degree with vaccination. Not having vaccination doesn't give you any protection for these. And if you've had COVID, while you do have antibodies, you will not be protected for the variant strains. Yes, for the Pfizer and the Moderna, After 2 weeks of their second vaccine, they will be considered fully vaccinated. The Johnson & Johnson was put on a temporary pause in April. After further review, it was put back into circulation, and it is available again with warnings for people that may be at risk. So women that are under the age of 50 may want to consider taking either a Pfizer or a Moderna. You can choose the other vaccines by going to the vaccine.gov or calling the local health departments and finding out where you can get one of these vaccines. The only vaccine that is approved for 12 to 15-year-olds is the Pfizer vaccine. This will require them to get 2 vaccinations, 21 days apart. And children can transmit this disease to other people. So while they didn't become very sick with the virus, they were able to transmit it to people who were very susceptible. If you are interested in your child getting a vaccine, you can call your provider. You can contact your local health department, or again, you can go to the vaccine.gov site, put in your zip code, and it will give you a location that's closest to you. We've learned a lot this year. We needed to have 70 to 80% of our population vaccinated in order to be at herd immunity. And without that happening, we're still going to have to take some precautions. So businesses may still ask you to wear a mask, or they may ask you to sit some distance away from other people. Be supportive of people who are wearing face coverings. They may have somebody at home that is immunocompromised and they're trying to stay healthy. All unvaccinated people should be wearing a face covering if they're in a crowded area. Settings where people are going to need to wear a mask, even if they're vaccinated, are going to be public transportation, visiting in a hospital, or in a congregate facility. We don't know how long the vaccination protection is going to last. The virus has caused serious illness and thousands of deaths. Taking the vaccine is going to be your way to protect yourself from getting this virus. Just like the seasonal influenza, we may be required to take a vaccine for this annually. In addition to taking the vaccine, it's important for us to continue to use our hand sanitizer and wash our hands, wear masks if we're not vaccinated, or wear them if we're in a crowded location. There's been no definite decision on whether or not a booster is going to be needed for Pfizer or Moderna. They are looking at a potential third dose. There is nothing certain about that right now, and Johnson & Johnson is looking at potentially a second dose, but there is nothing definite about that coming this fall yet. Do what you can to stay healthy. As viruses circulate, they have to adapt, and when they adapt to the community, they change, and they mutate. So this is called a variant strain. One of the ways that we can reduce variant strains is by not letting the disease circulate. And again, this is another reason why vaccination is so important. Staying healthy beyond COVID means keeping up with your appointments with your physicians, especially if you have a chronic illness.
At this time, FHN is not doing any scheduled vaccination clinics. However, if there was enough interest, we would entertain the idea of starting those up again. At present, there are a number of other options that are available for people locally, and that could be at a local retail pharmacy such as Walgreens. The Stephenson County Health Department has been working closely with the Illinois Department of Public Health in doing some clinics as well throughout our community. One clinic that is getting scheduled soon is going to be held at our Stephenson County Fair. As soon as we hear more information about these clinics, we will be posting those on our website. But in the meantime, you can check the Stephenson County Health Department for the latest information and availability. But as always, any of the retail pharmacies such as Walgreens are available to provide that vaccination. Thankfully, there's no cost to receive a vaccination. There should be no out-of-pocket costs. The vaccines are funded federally, and that's to make sure that it's accessible to any and everybody who chooses to become vaccinated. There's been a lot of discussion about herd immunity, and we simply are not there yet. And with the rise of all of the different variants, it creates a challenge. When we're looking for herd immunity, we want to be able to eliminate the number of hosts that a virus is able to feed off of and continue and to spread. And when we have a large amount of hosts, the virus is able to move around, and variants or variations tend to become more prevalent. Early on, the Illinois Health and Hospital Association used a little bit of a tagline about vaccine against virus or vaccine versus virus. Right now, it's really a race, and it's vaccine versus variant. So please do encourage all of those individuals who are looking to become vaccinated, or at the very least, using a bit of awareness and keeping each other safe. Throughout Northwest Illinois, we've been doing pretty well as it compares to the rest of the country. In fact, this morning I was able to go on to the Center of Disease Control's website, so I'll share some numbers and statistics with you that are directly in our area from our surrounding counties. Please note that this data was available and updated as of June 29th, so it may have changed by the time that this video is released or that you're watching it. But at present, per the Centers of Disease Control and Prevention website, Stephenson County had an overall vaccination, so fully vaccinated rate, of 44.7% of our population. Within that, 89% of individuals that were 65 years of age or older have been fully vaccinated. In Joe Daviess County, 61.2% of the population has been fully vaccinated, and these are people that are declared residents, and that's their home of residence that's recorded, and 99% of those over 65 years of age. In Carroll County, 46% of residents have been fully vaccinated, with 74.8% of those over 65 years of age being fully vaccinated. In Ogle County, we had 39.9% of the total population and 71.6% of those over 65. In Winnebago County, we had 39.7% of the population or residents fully vaccinated, with 72.5% of those greater than 65 years of age. And to the north, in Wisconsin, in Greene County, 51% of the population has been fully vaccinated, with 86.8% of those over 65 years of age being vaccinated. Unfortunately, we are still seeing COVID patients, and we're seeing patients at various age groups or a big variety or widespread. We've seen patients in their 40s, in their 60s, and even then to the later ages. Thankfully, right now as I'm recording this, we don't have any patients on a ventilator. However, just a few days ago, we did have a patient that was COVID-19 positive on a ventilator. At the hospital today, we currently have only one patient that's COVID-19 positive, which we're grateful for. However, it is still very much alive and in our area, which requires us to continue to maintain those safe practices to protect our community. We are maintaining some of our current guidelines from the Illinois Department of Public Health where it comes to sanitation, sterilization, masking, keeping our facility safe, making sure that we're doing screening, and all of the protocols that we have been doing prior. We feel like it's our commitment to our community to maintain that safe environment for anybody who's seeking care so they can be comfortable and know that when they come to a healthcare facility, they don't have to worry. It's probably one of the safest environments that you could be in. I'm grateful to share that FHN is back in full business. We've resumed all services at some shape or form or capacity, and we're ready, willing, and able to be privileged enough to care for you or your family's needs. So don't hesitate in coming in and seeing one of our talented providers or working with our great staff. In summertime, sometimes health is not the most pressing things on people's mind, but it's one of the great times to be able to get access into your provider office. A lot of times people are delaying care until fall or until later in the year, and it gets a bit busier. With summer vacations, we all have a lot of things going on, especially those with families and getting out and being able to enjoy it. It only takes a few minutes to come in and make sure that you're being well taken care of. So any type of care, whether that's preventive screenings, whether it's a potential surgery that you've been avoiding, or just a question that you have for your provider that you really need to sit down and talk through, is, again, we'd be privileged to be able to care for you or your family. One of the things that I'd like to encourage our entire community to think about is really being respectful and accepting of the diversity of opinions that we have throughout our community, especially as that applies to health. We need to be respectful of people's personal levels and comfort after a year of a lot of change and restrictions. Coming out of this may take a bit of time. And so we see people that are wearing masks or are purposely trying to create distance between others. We should also be sensitive to that and be aware of it and respect people's choices as we look to support all of our local businesses and, again, take advantage of the beautiful area that we have. It is a great time of year to go out and enjoy and to be able to reconnect with so many people throughout our community and to do so in a way that's supportive and caring for one another.